Hi, I'm Dr. Atiyeh and welcome to the Thyroid Relief and Metabolic Center. I've been in practice for over 26 years, and in that time I've seen a whole lot of things that don't work, and I've seen a lot of things that do work. And in this brief video, what I want to do is describe to you some of the things that do work and why this office is a lot different than many other offices out there. If you suffer from a thyroid condition or have symptoms associated with the thyroid disorders, I know how incredibly frustrating this can be for you. You're having problems losing weight, hair is falling out, depression, and so on. And so far, most likely, the only solution for you has been some level of medication. Now, in traditional medicine, since this is how it's been since the 1960s. Today, what I want to get across to you is that there's new approaches to these kind of conditions and other autoimmune disorders, and we can do something about this. We look at things a little bit differently. For example, the pituitary produces a hormone called TSH, which stands for thyroid stimulating hormone. This tells the thyroid to produce T3 and T4. T3 is the active portion of this. T4 is the inactive portion. However, the body transfers T4 into the active portion through a couple different processes. One is in the liver and the other one is in the gut. So obviously, if you've got a problem with a congested liver or you don't have the normal or proper flora in your gut, then you're not going to get this T4 or made into the active portion, the T3. So in order for all of this to be effectively assessed properly, we need to assess the whole body, the body as a whole, to see exactly what it's doing. We call this a crosstalk. The thyroid crosstalks with the immune system, it crosstalks with the gut, it crosstalks with the endocrine system. As a matter of fact, every single cell within the body has a receptor for the thyroid, various thyroid hormones, and there are 12 different markers for these hormones. So we're talking about antibody testing, free T3, thyroid binding globulin, and a number of other things that we need to test. We get a picture of the complete physical system and endocrinological system in order to assess your problem properly. So you might say, well, my doctor has already checked all these values and everything is normal. Well, what you may not understand is that your doctor may not be working within what we call functional ranges as opposed to traditional lab ranges. The functional range of TSH is 1.8 to 3.0. The normal lab ranges are 0.5 to 5.0. This is based on a typical population of people that come in over a past year or two, and they put this together as what they consider to be a normal range. Well, there's a lot of sick people coming in with testing that skews the ranges, so you may not be within the normal or the functional range. We consider the functional range from there, and by using these functional ranges, we're able to assess, is the information being sent to the thyroid proper, and is the output from the thyroid being handled properly? It is not always black and white. The treatment I've developed is called neurometabolic integration. So let's say you have Hashimoto's thyroiditis and being treated for a thyroid problem. It's not going to work because it's not a thyroid problem. It's a problem with the immune system. As a matter of fact, the Endocrine Society has stated that at least 80% of thyroid disorders are autoimmune disorders and not being treated properly. I've taken a whole lot of steps and a whole lot of training to this point to understand exactly what's going on in these types of disorders. The bottom line is, we can do something for you. What we need to do is sit down and talk about it, see where you're at. On the website, there's an area for you to fill out, and a report to fill out, and you can make a decision from there. You can give us a call, and I can talk to you personally. That's not a problem at all. We commonly run a few weeks for new patients. If you are in dire straits and you need to get in immediately, let's see what we can do. But we'll need all the lab work that you have, all the testing you've had done in the past in order to do that. The key is we are different, and we can help you. I'm Dr. Atiyeh, and I hope this has been fruitful for you. Give us a chance.